Good afternoon, everyone. It is 1:30, so I'd like to call the Hospital District Board of Directors meeting to order. And I'd like to add that this is our first ever just solely Hospital District Board meeting. And I just want to thank everybody for putting forward this initiative, and we can have a proper lengthy meeting and talk as long as we want. Well, not as long as we want, but I'd like to acknowledge that we are conducting this meeting on unceded traditional territories of the Shuswap and Huipachesset First Nations, and we're grateful for the opportunity to do so. We also have directors calling in from other territories. I would like to also acknowledge those nations and express our gratitude and our respect. And notice to attendees and delegates that this meeting is being recorded and live streamed to YouTube on the Regional District website. So we'll start off by doing introductions. We'll go around the room, and because this meeting is in a hybrid format, we'll go online and the directors that are zooming in can introduce themselves. My name is Debbie Haggard, and I am the chair of the Hospital District Board of Directors.
Good afternoon, Cynthia Dick, General Manager of Administrative Services.
Good afternoon, I'm Mike Sparrow, Regional Director for Cherry Creek.
Good afternoon, I'm Susan Roth, and I'm for Beaver Creek.
Good afternoon, I'm Daniel Siam, the CAO for the ACRD.
Thank you. Now we'll go online. I'll just go in the order that I see you. Director Sika, please introduce yourself.
Data Siga, Director for Area C Long Beach.
Thank you. Director Beckett.
Good afternoon, everyone. Bob Beckett, representing Banfield Area A.
Thank you. Director Steer.
Yes, good afternoon. Councillor Tom Steer, Appointed Director, District of Tofino.
Thank you. Director Boyko.
Fred Boyko, Electoral Area Director for Beaufort. Thank you.
Thank you. Director Cote.
Aklama Penny Cote, I'm the Electoral Area Director for Sprout Lake.
Thank you. Director Coots.
Good afternoon, everyone. My name is Mariah Coots. I'm here for the Ho-Chukwu Tribe Government.
Thank you. Terry, are you there to introduce yourself?
I am, thank you. Terry Fong, Chief Financial Officer here for the Regional District and Alberni-Clayoquot Regional Hospital District.
Great, thank you, everyone. We have an agenda in front of us. Is there any additions from directors? Seeing none, is there any additions from corporate officer?
No additions, just the amendment with the presenter today.
Thank you. Could I get a motion to approve the agenda as amended? Moved by Director Sparrow, second by Director Roth. All in favor? Any opposed? Motion is carried. Any declarations or conflicts of interest? Seeing none, we have the minutes from the Board of Directors meeting held on October 22nd, 2025. Is there any errors or omissions? Seeing none, get a motion that the minutes of the Alberni-Clayoquot Regional Hospital District Board of Directors held on October 22nd, 2025 be adopted. Moved by Director Ross, second by Director Sparrow. All in favor? Any opposed? Motion carried. And we have a guest speaker here today. We have Jesse Turbotten, Director of Capital Planning, Real Estate and Leasing from Island Health, and he's going to be here talking about Tofino General Hospital and the new role of the Ministry of Infrastructure. Welcome, Jesse. We're very happy to have you here. Please go ahead. Anytime you're ready.
Yeah, thank you very much. Yeah, just to start out, I'm here on behalf of Kim Carone, who the VP, who I report to, the CFO. She unfortunately was called into another meeting, so hopefully I know I won't do probably as fine a job as she would do, but I'm going to do my best to provide a update on where we're at with the Tofino Hospital, address what the this new Ministry of Infrastructure is and how it's impacting project approval timelines and what we might expect to see. And then I'm happy to take sort of questions after that, and I'll do my best to answer them. Okay. I was going to go back to my notes here. Okay, so jump in if I'm restating things that you already know, but I'll just briefly recap the submission history for Tofino Hospital and where we are at right now. So the ministry requested a concept plan some years ago for a new Tofino Hospital. We undertook that concept plan and then submitted it in May of 2024. And in the interim time between the submission and now, they requested multiple updates to that submission, including new budgets, changes, scope options, removing certain aspects of the plan that sometimes were added in there because of provincial policy. A lot of back and forth with my contemporary over in the ministry, Heather Salke, who's the director over there and now in the Ministry of Infrastructure. So that's a long time ago, of course, and we didn't hear a response on the submission, a formal response until the budget letter that we got. I believe it was last month. I think it was October or late September. That sent to Kathy McNeil from the Assistant Deputy Minister of the Ministry, the new Ministry of Infrastructure. So in that letter, they indicated that they wanted to have a revision of the concept plan that reduced overall project costs and was closer to maintaining the existing service profile of the existing Tofino General Hospital. And I guess the proposal that the concept plan that we had put forward was in consultation with the community and also with our clinical teams, and it did include more than incremental growth of certain areas to try and accommodate some services that aren't currently housed within the hospital. Also included provision for long-term care and hospice. It was quite ambitious, but certainly was about the need that was being expressed from our clinical colleagues and also the community. And that the concept plan itself was approved by our board of directors, but of course it's up to the ministry to decide whether they want to proceed. So basically they were concerned about the cost, especially given the budget crisis well, I don't know if it's called a budget crisis, but certainly for Island Health, getting budget reduction targets, and then also at the ministry having issues province-wide. So I'm not certain that that's part of it, but I'm sure that that's part of their consideration of this. At this point, I've gone back to the ministry and to try and understand exactly what the allowable scope boundary will be. So exactly what they're talking about, what the expected cost envelope is so that we know what we're actually targeting, and just some idea of, before we dive back in to redo the whole thing, it was a good piece of work. I think it can be used. A lot of it can carry forward no matter if the scope is altered. So that's why I'm looking for back to the province to give me some guardrails here so that we can reasonably move this forward quickly and get a resubmission as soon as viable. So I don't have answers yet on what the parameters are, but this is fairly fresh, but I expect them to be provided fairly shortly. So, yeah, where does this kind of leave us? Clearly, it's not the outcome that Island Health or your communities were hoping for, and it's been a long time since the 2024 submission. So on the upside, they're not canceling the project, but they are asking with not too much of detail for a revision again of the concept plan beyond the two that had already been provided. My hope is that we can do, a minor update and then resubmit it once we know exactly what the parameters are. So yeah, using the strong work that's already been completed and including the needs analysis, functional planning, all that kind of thing. A lot of that work, it took a long time and it was well done. So I don't expect that it is going to be a complete restart. That would be very inefficient, and I've expressed that back to the ministry. So the next steps for Island Health right now are to obtain the ministry cost and scope parameters, revise the concept plan according to those requirements using our existing work, prepare a new timeline, and we can once I've heard back from the ministry and we know the scope of the changes, I'm more than happy to join this meeting again, let you know what the timeline is, what their response was on exactly what their thoughts are, their issues were with the concept plan. And then we can move forward to submit in as expedited a manner as possible. So yeah, that's kind of the update on, or not kind of, that is the update of where things stand with the Tofino Hospital concept plan. I'll pause now, happy to take questions at this juncture.
Thank you for that update. Director Steer, please go ahead.
Yeah, thank you through the chair. And Jesse, you're the forebearer of news that I was not hoping to hear. So I'm not going to, disappointment is a mild word, of course, and I won't direct it to you. We have an MLA that I'll certainly be in conversation with. Just to give you context, this has been going on. I've been involved with this conversation since 2017. So the 2024 concept plan submission was 7 years down the road from the initial conversations that were going on. So you can understand the disappointment. I guess I don't have too many questions because I'm just digesting some of the information that you brought forward, and I might be able to come up with some better ones in a moment. But when you talk about initially the overall concept plan, like what our submissions through community consultation and the work I know with Island Health was around a campus of care. And I'm wondering if there was any indication of what that reduction in service levels, maintaining, I think you said maintaining the current level of service. We have made a clear case that that is not going to be appropriate. We have, as you know, clearly articulated the scope of our needs have increased dramatically, not just due to our tourism economy that is on in the West Coast, but certainly with the increased level of First Nation involvement in the healthcare system and the lack of services being provided in those areas. So I'm wondering if there was any conversation around just sticking with the status quo and what they mean by and I wrote down the words, but I can't read my writing now, in terms of maintaining basically the basic level of acute care services that are in there. Was there any indication of what that actually means?
Yeah.
And I have a follow-up question.
Yeah, so right now that response from them is pending because the line that was in the budget letter was not very descriptive, except for the sort of reference cost. And so I know from the previous back and forth that I had with the ministry on the concept plan, they were concerned that it was beyond sort of the increase in services and the costs related to those were of a concern to them. What I don't know is what exactly they're referring to, what they would like to see brought down, and then also, we made a compelling case in the concept plan itself, and the community has done so, which is basically, this is what is needed in this community. So I'm waiting to see what they're actually asking here, and that's part of the missing piece here. And like I said, once I have that information from the ministry, and I'm sure once you talk to your MLA, perhaps we'll get some more information. I'm happy to come back and discuss those further details with you on exactly the details of those budget reduction, how they expect that we are going to achieve that.
Great, thank you. And I won't follow up questions now. I see a couple of other directors have their hands up, so I'll allow them to speak and then maybe come back later.
Thank you, Director Sika. Then Director Cote. Please go ahead, Director Sika.
Thank you. I'm sorry that you're put in the position of having to bring this forward. Obviously, it's very awkward because it is very bad news for the communities. It seems like the Ministry of Health is building to needs that were identified as of 5 years ago, and they're always playing catch up these days, which puts them in an unfortunate position of having to renovate hospitals, which is, I believe, harder on the overall budget. So hopefully some thinkers in the ministry can be convinced that we have to build to our futures, not to, 5-10 years ago. We're not like out where we are. It is a significant travel time from many of the communities to get services. Many of us are paying out of pocket to get just basic services that those in the Capital Regional District take for granted. And there's also the added stress of tourism and what it's doing to our health services and our health needs. So hopefully, I know this is not your issue. I know it goes up to the top at the Ministry of Health, but hopefully you can, let them know that we can't be walking backward at this point. And I don't think this will be taken lightly. Thank you.
Yeah, thank you for that. And, certainly the concept plan itself has incorporated in it what the reasonable increase in service would need to be in order to meet the current needs of the community. And of course, the tourism side of things is sort of creates that extra pressure on the hospital during those months. So yeah, that was included. Those surge times were included in the concept plan as well. So they're well aware of those issues.
Thank you, Director Cote.
Thank you. I just attended the health summit or whatever it was in Nanaimo last Thursday, and was made aware of the new Quatsim Hospital, Cowichan Hospital, that's going in, and the hundreds of millions of dollars that's going into bringing this new hospital forward. It just seems to me that once again, the Alberni Valley, anything in our regional district is being left out in the cold. Every time we turn around, there's another, not for us. We're not included in any catchment, any kind of new proposals, any kind of helping sustainable equity for members of our communities. We have a huge First Nation community. I think that would greatly benefit from a hospital such as the Cowichan model. And I don't know why we're not talking about that now. Budgets are one thing, but it has to be equitable across all of British Columbia, all of AVICC area, our island health. It needs to be equitable. And, my filters are off, painkillers, whatever it is. I'm just set back again by, what's happening to our area. Once again, we're left out in the cold. Like, why is this? What do we have to do to be recognized so that, I've been on the board for 21 years now, and we've been talking about Tofino Hospital that whole time, and haven't gotten anywhere. I think there's been a little bit of renovations done to it already. It's on its last legs. It needs to be addressed. So, I understand, you're just the messenger, but the message is not a good one. And, I don't know how we're going to sort of wound you to go back and say that this isn't being well received. But I know it's not your fault, but it's just typical of what's happening with our Alberni Valley Regional District. Thanks.
Yeah, thank you for that. I understand the disappointment here, and happy to hear that being expressed. What I can offer, and I hope that I will be able to offer through this conversation, is that what the way forward is from here, in terms of how do we get to the place we need to get to, given that it's been such a rocky road. It took a long time, I know, for the ministry to request the concept plan, and the concept plan took quite a while. And of course, it's because it's a very detailed piece of work. So definitely understand the disappointment. And yeah, I have been, of course, I've been up to Tofino Hospital, and I know that it's in a suboptimal state.
Thank you. Director Steer?
Yes, thank you. And through the chair. Thank you, Jesse. A couple of questions, and I think it's, I mean, there's no, the reality is the complete disappointment that's here. And I think we'll be expressing that more appropriately to our MLA in this conversation. It's not for you to hear those. But what I'm interested in right now then is you talked to a couple of things about the, in essence, the resubmission of the concept plan, and you indicated about allowable scope boundaries and about that cost envelope. And I'm wondering, with your conversations with the ministry now, have you submitted that request? And you said, I think, provided those answers will be provided shortly. And I'm wondering if you maybe are able to give the board an idea of what is meant by the allowable scope boundaries. I think I'm clear on that. And then that cost envelope that is associated with it. Could you maybe expand a bit on that?
Sure. I mean, perhaps I didn't, yeah, so let me answer your question. And if I'm not answering the question you're asking, just ask me again. The answer to what I think you're asking is, we need to know what they've indicated they want to see a lower cost solution for Tofino Hospital redevelopment. And so in order to know what we are actually going to present to them, we have to understand what the overall budget parameters are. Like if we're going to try and build or design to budget, and or hopefully both, which services that were presented within the concept plan are the ones that they don't see as the ones that they want us to carry forward, and what is the rationale for that. I meet with the ministry on a weekly basis. I've formalized my request in email to the director over there. And when I say short, I shouldn't say shortly. You know, I was told shortly that we would get a response on the concept plan for more than, you know, like a year and a half. So in this case, they know what the urgency is here. I don't think it would be remiss to, you know, message that back to your representative and see if we can get them to move faster than what's happened so far. I mean, I understand the pressures of our provincial colleagues, of course, but I don't want to be in a position where we just go and I can't redo a concept plan, or our consultants and our team can't, with no information about what they're actually asking. And that's what I've actually put back to them, and to give some of the idea of the scope and the budget. Like the original amount that was approved, you know, for at the pre-concept plan stage was like about 120 million. There's no way you're going to get anywhere close to a replacement of a hospital for that. And so we just need to understand what the limitations and where we're at with that, and then we can have that. I can have that discussion in an informed manner. But I will express to Heather that, you know, there's a need to provide you know, a speedy answer on this, so we can get underway and understand what they're actually asking us. Did I answer your question, or did I not answer it? Maybe I didn't answer it.
Well, you did, in the sense that, you know, I just basically, you know, until you get information, there's not much you can say, because you've asked for the information around those allowable scope boundaries. So what is it like? What in that concept that was submitted are they going to axe in essence? And what is the, you know, I'm curious as to the budget. You know, the Cowichan, of course, was $1.5 billion. You're talking 120 million. We're seeing definitely a scope difference there. So I'm curious because I know what cost of building is out here just in general. I would add that, you know, and I don't know if it was submitted within the concept plan, but there's been a lot of local conversation around, you know, land, around what the, and at this board table about what those contributions will be, as we are a very important piece of that capital conversation at the Regional Hospital District Board here, as you well know. And that conversation has not even come towards the board in terms of when we're talking about cost, what those may incur for us. And so we're willing to have those kinds of conversations. We have a hospital foundation that is willing to have those kinds of conversations. Yet I don't know, I'm not hearing any of that type of conversation going on. So needless to say, and when we're talking about once you have a cost envelope that you can work within, those pieces of the puzzle also have to be included in that conversation. It's not just the Minister of Infrastructure that, you know, they're going to be the big ones that will be providing, but there's also other areas for us to be able to do without limiting that scope that we know is critical to providing healthcare services to the whole West Coast region. So anyways, I can go on, and I apologize, but you can understand the extreme frustration that is coming out, certainly from the whole Alberni Valley, but certainly on the West Coast here.
Yeah, I think one of the revisions that they had asked for was to parse out different elements, specifically the long-term care and hospice. And I think there was at one point a childcare element to this. That was at a time when the province actually required it, and now they seem to have walked that back. So yeah, that my hope was that they were gonna provide us, you know, based on that update, surely they can make a decision, but it wasn't to be.
Right, and then if I'll just add, sorry, and I apologize through the chair, just in terms of most recent conversations on the West Coast, where long-term care, we are in conversation with a faith-based organization that through Providence that is having conversations right now in terms of that long-term care and childcare. As you know, the Ministry of Education, as we have now got a childcare space that the District of Tofino has taken on, where we now have 72 new spaces created on the West Coast. So those kinds of conversations, yeah. I'm not sure if the Ministry of Infrastructure is aware of those pieces of the puzzle. So anyways, I'll leave it there.
I mean, you know, there's a long time frame since, you know, this thing, you know, was started, you know, more than a decade ago is what I'm hearing. But then, of course, since the submission of this of the concept plan, of course, things have evolved significantly on the child care side and so on. And so, you know, I'm keeping them updated of that.
Thank you. Before I go on to further questions, I just want to let you know, Jesse, that at UBCM, as chair of the hospital board, I supported Director Steer and the Tofino City Council in a meeting with Island Health at UBCM. And I really tried to stress the fact that this is not a City of Tofino initiative. This is a regional initiative, and we fully support it. And our board has been putting away funds every year to try and build up a little nest egg to support the building of the Tofino Hospital. Director Boyko, please go ahead.
Thank you, Chair. I think that the theme of this meeting is frustration, but one of the things that's happening like in Port Alberni right now with regard to Island Health and things like this is apparently our ICU is going to be shutting down tomorrow for a couple months, and staff was told, but nobody else was told. There's no news announcement. So it's in the media now, but it's a little bit frustrating when we hear things like this and we get notes and things like this. Hey, what's going on with the hospital? But we have no idea what's happening. There's nothing official said. So,
Director Boyko, I'll be talking about that in my report.
Pardon me?
I'll be talking about that in my report today.
Okay, I'm just making everybody aware. Thank you very much.
Director Sika, please go ahead.
Thank you very much. Yeah, I'm aware of it's more of a staffing issue than a facilities issue in terms of the emergency closure. But I just would really appreciate it, Jesse, if you could bring back to any discussions about the Tofino Hospital, how critically important it is. Like I've heard lots of speech from the ministry lately about aging in place. Well, having had to be a caregiver out on the West Coast, I had no help with bathing, with any activities, care. The closest option I would have had was to go to Port Alberni, and they absolutely did not have any spaces available. When it came time for placement, my husband had to go to Duncan. Now that is an entire day out of my life to go and visit him. So if you are serious about aging in place, you better take another look at the services that could be offered through the hospital in terms of supporting people who are aging in place and their access to supportive care, bathing, allowing respite care. Like even if you had respite beds, if our seniors weren't taking up beds in those spaces, I know that I was offered respite in, again, Duncan or Courtney, 3 hours away. To me, it's just not acceptable with the speeches that are coming out of Island Health about aging in place and stuff to have any cutting back in terms of seniors care and hospice care. It's just unconscionable.
I have to be clear that it was not my suggestion. Like we included that into the scope of the concept plan for the Tofino Hospital. So we would never, we understand the importance of that aspect, or it wouldn't have been included in the work. This is just, so I don't know what they're going to come back with, honestly. So, but I'm happy to provide that feedback directly.
Thank you. That's all I'm asking, is that you let them know that this is not just simply a replacement. This is looking at the speeches that they are giving in terms of what the direction of healthcare is going to be. Thanks.
Thank you. Director Cote, please go ahead.
Thank you. So looking at the Cowichan model going forward, I'd like to know, does our regional district have a similar model that we can follow? Or have we started that model where they had an Indigenous relationship team? Do we have that yet in place? Because I think that's important moving us forward. And what kind of services are we looking at that we would be bringing forward or not bringing forward? I'm not aware of what that would be, because I don't think we have a lot of services now. I thought the whole idea of a new hospital was to actually have improvements rather than cutting back on services. So a couple of questions there. Thank you.
I'm trying to unpack how I answer that. I don't know what the proposal will be in terms of what services will be included and what won't be. It was quite comprehensive what was put forward in the concept plan. Again, it's the ministry themselves that are going to hopefully respond and provide us with some guidance on that. Are you talking about a team at Cowichan Hospital that was about building relationships with First Nations related to the hospital, or are you saying something different?
It was to the build on the hospital. So the size of their rooms, the cultural integration into that service model.
Yeah, I'd have to go back and look at the concept plan, but I know that there was outreach that happened. I don't know if it was formalized in the terms of, I don't know whether it was a regional relationship team that you're describing, and I could certainly feedback in terms of what was included within the plan. I don't have it right now in front of me, but I could dig it up and just sort of see how that was addressed. But it's a little bit, there's a difference between coming up with an actual design of a hospital and now they're actually under construction. And we're a year out from actually completing, but Wesley Davidson at and the Health Authority is the ED on that, and I can ask him for some details on that, if you'd like me to feed back to you.
I would love to hear more about that because that's what was presented to us at the hospital conference that we went to last Thursday. Was they were talking about the Cowichan Hospital and how it rolled out, and all about the Indigenous relationship team that they had, what services, how it played into things like the size of room, and that there's rooms where they could have fire, where they could do smudgings, where they could do their ceremonies, bring the language in, bring everything in, which I think is a perfect model for Tofino, being so surrounded by First Nations peoples. They probably outnumber the Tofino residents in that area. Thank you.
Thank you. Director Steer, please go ahead.
Yes, thank you. Through the chair. Thank you, Jess. And I do want to say that I appreciate your presence here today and the ability to take these questions and bear the brunt of the frustration. And I very much do appreciate that. And I do have to say, I am troubled by the fact that the Ministry of Infrastructure was not here. And they're making service level decisions based on cost, not need. And they're it's the wrong place to be putting that. But anyways, that aside, I would like to ask you in the end here, the path forward. What is it that the district board here can do to help expedite this path forward? Is there any role that we can play? I did mention, certainly I'm going to be suggesting to the board a letter to our MLA. In fact, if there was any other suggestions, that would be much appreciated for the board to be able to action some of those items here today.
Yeah, I think just in terms of communicating the need for, comprehensive feedback on what they're actually, where they felt the weaknesses were in the concept plan, how they want to actually see it addressed. Because a couple of lines in the budget letter is not sufficient to build a revised plan on. And I'm sorry that I'm not here with more details, but that's kind of what I have right now. And I'll say the same to my contemporary and to Kim as well.
Thank you. I've got notes here that we'll be able to discuss with the board. I will be making a motion to forward that letter to our MLA. Would it be appropriate as well to CC? Would there be a contact within the Ministry of Infrastructure that we can have? That would be the appropriate place to CC this letter, if you think that would be appropriate.
I don't know 100%. I know that Amy Miller is the Assistant Deputy Minister for the Ministry of Infrastructure, but I'm not actually sure what the protocol is in terms of who gets CC'd onto things. I know that the bureaucracy are different than the politicians, which is oftentimes where there's a disconnect, right? So yeah.
Agree with that. And I think
that's the message that I'm giving them. Anyways, so there's obviously you're going to have a different perspective given that you're all very impacted by this.
Yeah, I think, thank you for that. And I agree that there is sometimes, there is often a disconnect. I think Minister Ma would be then the appropriate person for us as well as our MLA. So thank you.
Any final questions on the Tofino General Hospital? Okay, seeing none, Jesse, please go ahead on the new role of the Ministry of Infrastructure, if you have any comments.
Yes, okay. Okay, so until late 2024, major health capital decisions were coming out of the Ministry of Health, and they were made through a branch called the Capital Services Branch. And that branch had a manual of all the various different requirements for every business plan and concept plan, all of the thresholds for cost. It's fairly prescriptive. And as part of the reorganization of government in late 2024, and forgive me if I don't have the exact date, but they mandated a new ministry. And so they are now responsible for all major capital project approvals, procurement and delivery of hospitals and health facilities in some cases, although I haven't seen them stand that up. They're trying to exert greater control over the overall provincial capital program, so it's unified through one ministry. The idea, I think, is greater efficiency and enhanced decision-making when things make it through to the Treasury Board, which is really your last stop on getting things approved. Once the Tofino Hospital business plan does get to the Treasury Board, their approval will be the last item before the budget is set. So this brand new ministry is massive, and it's taken quite a few months to staff it up and stabilize it, and then figure out what the new roles are internally, and pathways and approval processes, and the decision-making structures still seem to be evolving. So that transition has impacted a lot of timelines for capital projects across the province, not just this one. I would say it probably had some impact on the Tofino concept plan. And however, my longstanding contact at the Ministry of Health has moved over to the Capital Services branch, so at least there's continuity there, and she's been great to work with. It's not her decision on any of these things. We work together to try and put forward everything in to get the most success possible. So basically a new ministry making capital decisions. All the operating dollars about who's paying for the nurses and docs and so on within the hospital are still based out of the Ministry of Health. But it sort of has led to a bunch of different kind of scrutiny on all our projects that didn't maybe exist before, because they're going to folks that aren't aware of healthcare special requirements on CSA standards and some of the increased costs for that type of infrastructure. So yeah, that's the long and the short of it. I don't have happy to take questions on that. Basically, they've taken all capital decisions across the province and centralized them in a new ministry, and staff slowly are staffing up that ministry. But it's led to, I think, greater scrutiny of capital projects, which likely impacted the approval of may or may not. Speculating, it may have impacted this concept plan.
Thank you. Before I go to Director Steer, I'll just let the directors know that I did go to a Zoom meeting with Minister Ma and Minister Osborne, and they explained the differences between the two ministries and what the new Ministry of Infrastructure is responsible for. And I do have a slide deck. If you directors would like, I could certainly send that out to everyone. And that it's just a little bit more detail about what the new ministry is responsible for. Perfect. I'll do that. Thank you. Director Steer, please go ahead.
Yeah, and it's not so much a question directed to Jesse, although I will reiterate, certainly you indicated clearly that their lens is through a cost without the expertise in service levels at especially something like healthcare. That's been clearly demonstrated by this decision here. But I will look to the board in terms of as part of the letter that I'm going to be requesting. I'm also going to be requesting, if the board sees fit, to have a representation from the Ministry of Infrastructure come and explain in more detail. Unfortunately, Jesse had to take the brunt of this, even though that is not his ministry that he is responsible for responding to. It is the Ministry of Infrastructure. So it would be appropriate for them to come themselves to explain to the board their decision around having to ask for a revision, for lack of a better description, on the concept plan that had been presented. that had been presented with great work done by the ministry in collaboration with many of the community services there. So it's not a question for Jesse, but it is going to be something that I'm going to be asking the board once we have time for that discussion.
Thank you. Any other questions or comments? Director Cote?
Thank you. So this new ministry, how far do they go? Do they go, are they responsible for any rebuilds or expansions on hospital for like a new wing or something? So, you know, if we're going to get a new machine and you need an extra room or whatever, are they responsible for just the infrastructure, or are they also for the machinery, I guess?
Yeah, I mean, capital over a certain value, equipment over a certain value is considered capital and is approved through the Ministry of Infrastructure. So anything above 10,000, I think, on the equipment side. And yeah, there's thresholds of different, like, it's quite complex in terms of all the different thresholds that are required for different levels of approval. So a project such as the Tofino Hospital is over $50 million. So they require a bunch of different hoops to jump through. The concept plan, you have the concept plan approved, and that means that you can go to business planning, but at that point they've actually committed the dollars. And then the business planning takes a period of time. So they're, you know, and then for different things, there's different levels of detail that are required by the ministry as well, in terms of like length of business plan, supporting materials and that kind of thing. But a concept plan is pretty comprehensive in terms of what's being put forward to get that initial budgetary approval and incremental funding, so you can do the full schematic design and then bring it forward to completion.
So did I get you right that it's as low as $10,000?
Oh, but I'm not saying that they don't approve individual like equipment purchases and stuff like that. But at the end of the day, they do approve our capital budget. I'm sorry, I've caused confusion. You're asking me whether or not equipment is a capital asset. It is a capital asset. There are different thresholds over which we get involvement from the ministry depending on the value of that asset. They don't typically require a separate approval for things that are under $5 million.
Okay, thank you. Director Roth, please go ahead.
Thank you. This actually isn't about hospitals, but it's just brought to my mind. So with this new Ministry of Infrastructure, how does that affect BC Housing? Because that's what they do. Is it, I don't know the answer.
The housing, if they don't, is housing's not included in that ministry, is it? I thought it was housing is as well.
They would do the same kind of approvals through the Ministry of Infrastructure that we do for hospitals. That's why it's all being centralized. Previously, it was done through those specific ministries, and as we know, of course, the ministries change identities on not an irregular basis, but it's basically centralization of all capital decisions.
Yeah, okay. I thought it was just schools and hospitals, but anyway, that's okay. Any other final questions or comments for Jesse? I'll let him go and then you can start making your motions, Director Steer, if that's okay. I know it's not easy being an employee of Ida Health these days, but I really want to thank you for coming forward and doing your presentation and answering your questions to the best of your ability. So we just thank you for your time, and we'll
and I'm happy
talk soon.
I'm happy to attend whenever to provide information. It's not going to always be, hopefully it will not always be news that is not great, but yeah, happy to provide updates whenever is convenient for the hospital district.
Great, thank you very much, Jesse. Appreciate it.
Thank you. Bye-bye.
Okay, Director Steer, you'd like to make a couple of motions, please go ahead.
Well, there may be a bit of wordsmithing that's here that'll be needed, but the initial one is I would like, of course, to write to our MLA, Josie Osborne, to express, of course, our disappointment in the news that we heard today, and that can be wordsmithed in the way that would be most appropriate. And then with Jesse's, when I asked for that pathway forward, one of the things that he talked about was to have a comprehensive technical information to inform the revised, I think he said, used the word revised concept plan. So for our MLA to, in essence, put pressure onto the Ministry of Infrastructure to get that information expedited so that we can get that concept plan moved to the business plan phase as soon as possible. And I'm looking into the room and I see Daniel sitting there, and I don't know, and well, Cynthia, if there's a way to concisely put that, but it could it be just broad enough a letter to Minister or our MLA Josie Osborne to express our disappointment in the information provided, and to reach out to the Ministry of Infrastructure to expedite the information that is required for Island Health to revise their concept plan submission.
Have you got all of that, Cynthia? Could I get a seconder? Moved by Director Steer, seconded by Director Roth. Any final questions or comments? Cynthia, please go ahead.
Sorry, just clarification. Earlier you did mention inviting the Ministry of Infrastructure. Is this included in this resolution, or is it going to be a separate?
I'm going to do a separate resolution. I think that would be more appropriate to come from the board directly to the Ministry of Infrastructure to have some to have representation to the board to explain. Unfortunately, Jesse was the one that had to bear the brunt of this. But in my opinion, it should be the Ministry of Infrastructure clearly articulating to us the reasons why.
Okay, does everybody understand the motion, or do you want Cynthia to read it back? Okay, all in favor of the motion? Any opposed? Motion is carried. Please go ahead, Director Steer.
Yes, thank you through the chair. The next motion I'd like to propose is to write a letter to the Ministry of Infrastructure requesting them attend the Regional Hospital District Board meeting to inform the board of the decision to send back the concept plan to the Ministry or to Island Health for revision and expected timelines. Is that clear as mud, Cynthia, or should?
Just typing crazy like crazy here.
And maybe while you're doing that, Cynthia, maybe I'll look to our CAO to see, do you have maybe any advice as to maybe what would be an appropriate path forward in moving this to quote to the next level?
I've been thinking about that as we're going. I mean, it's a tremendous amount of power in the Ministry of Infrastructure at a $5 million threshold. It in essence is the bottleneck on all other ministries, and it's just I'm baffled that that's the approach that they would choose. Other than to, like in tough budget years, it's nice to have an excuse not to spend money, and a bureaucratic bottleneck is a great excuse. Yeah, like I would agree that we definitely want to follow up with our MLA to gain some clarity. One of the things that I was just jotting down notes as we're going is, what is the valuation criteria that's used by the Ministry of Infrastructure? Are we talking about just straight dollars and cents? Because the rest of the world has moved on from a straight economic and is, like how many years ago did we introduce social procurement? And before that, we had the triple bottom line. And so, you think that for decades we've been redefining value. And how money is spent and how decisions are made based on best value. So if we're now going backwards 40 years or more to say that it's just the lowest cost, I think it would be good for us to know. But like in addressing, I think what you're bringing up, Tom, is and what Veda was bringing up is that there are real costs associated with the lack of service delivery in health. And you know, like our Alberni Valley is a great example of that, around, you know, the opioid crisis and mental health. And when services are not available, every other aspect of community, every other level of government is impacted with a real hard cost that turns into a taxation number. And so I would love to know if Ministry of Infrastructure is paying attention to that. If they're not, then I if they're not, then I really think that we should take a look at what other regional districts have been doing for a number of decades prior to us, which is move up and down the value chain. And I know it's not a popular discussion, but other municipalities and other regional districts have been literally moving into the space of owning quarries, owning businesses, owning land. And that's how they are able to justify, even at a high cost, that a percentage of the profits for their companies, which are still publicly held, help offset costs in other areas. And so one of the disadvantages that we have as a regional district here is that we haven't done that, and by default we're on just the straight taxation model. So we don't have a lot of, other than user fees, you know, like we don't have a lot of diversity in terms of our ability to leverage different levels of value, right? And you and I have had this discussion as well around, you know, can we even donate land? Well, no, we can't, right? The land that we actually have is actually leased lands, right? So it's tied back to the province. So it's a real conundrum for us. And I think until we understand how it is that they are evaluating value, it's hard for us to develop a plan other than to push on the same political levers that we have been pushing on.
Okay, Director Sears made a motion. Could I get someone to second that motion? Moved, seconded by Director Roth. Any final questions or comments? All in favor? Any opposed? Motion carried. And Director Steer, you mentioned earlier that you would like to meet with our MLA about the Tofino General Hospital. If you'd like me to come just as a support person, I'm happy to do that if you want to let me know.
Thanks, Deb. Thank you, Chair. I do appreciate the offer. This one I might, when our walk on the beach happens, it might come up at that moment in less than formal atmosphere. But when she does come to the regional, hopefully we may want to invite her to our hospital district meeting or our ACRD board meeting in general, where we can ask her more broad and general questions as well. But thank you for the offer.
Awesome. Thank you. Okay, Director Cote.
Thank you. I think that we should invite Minister Osborne to a regional district meeting, hospital meeting, because I think that she is responsible for this service and she should be able to come and talk to us about it. Where we have all these questions. I'm getting tired of letter writing. It seems to take forever. And yeah, I'm really disappointed with this news today. It's very disappointing after coming from the meeting last Thursday with other areas of Island Health with such great news. Yeah, it's just I came away with promise in mind, and yeah, it's just not there. I would like to see us try to put together an Indigenous relationship team for the Valley and for the West Coast. I think it's important moving forward. All of the concepts that were integrated into the Cowichan Hospital I think would fit in here so well. And remembering that their hospital is built to a different standard and to $1.446 billion is this new hospital. So I would really like to see how we're going to be compensated to adjust with our needs, not what Island Health or whoever ministry is trying to push at us. It's not them, it's our community. It's what we need, what our needs are, and what we want. And it should be about us, with us, to move forward. Thanks. Off my little bandstand here. Sorry.
Thank you. I actually just made a note to look into the Indigenous relationship team and do some research into it. So maybe we'll come back on that. And Cynthia, did you make a note to invite Minister Osborne to attend the meeting? Great, thank you. Any other comments? Seeing none, no correspondence for action. We have one item for information. A news release from Island Health, a new report which highlights health gains and equities in the Island Health region. Director Steer, please go ahead.
Yeah, thank you. And this was an important report that came out. It really highlights the health gains and equities. And specifically, we did have a presentation, a conversation with Dr. Gustafsson at the Health Forward. She frequently comes up to Tofino. And in the report, it highlights those gains and inequities, but it really the report was really intended to serve as engagement and to support dialogue between public health, local government, and community organizations. And I think some of the things, there were some major takeaways in there. And one of those certainly was substance use continues to be elevated in Island Health region, but specifically in our central region, it still is the #1 public health issues, and that is alcohol, tobacco, cannabis, and the unregulated drug supply. So it really did once again emphasize it has implications in terms of life expectancy in our region, as an example. So it's something that I think is really important as a dialogue piece. And I think some of the takeaways also within that report were the sustained health promotion and preventions are key. And I think those are some of the policies that we can talk about. And I want to give a shout out to the city of Port Alberni for starting the work on a municipal alcohol policy as one of those that is part of that community engagement. The District of Tofino is also in the process now of a community alcohol strategy specific to exactly what this report is talking about, discussing what local governments can do with effective policy to help mitigate some of those harms that are associated with the things that have been identified in this report. So I think that's key. And the other piece of that is those upstream preventions. And for me personally, I see where the real focus, and this has been touched upon, is the focus on youth in terms of that promotion and prevention in terms of health. So it's an excellent report. It comes out fairly regularly. And it's something that I think the rest of the board, if they're interested in this, is something that we can use as a dialogue piece, certainly for the ACRD to have those conversations where we can have impact at the local government level on health policy in the province, but at a very localized level.
Thank you. Any other comments from directors? Would anyone like to move that there's correspondence be received for information? Moved by Director Ross, second by Director Boyko. All in favor? Any opposed? Motion carried. No decisions or bylaws today. Next, we'll go on to reports. Banfield Health Center, Director Beckett.
No report today, Madam Chair.
Thank you. Alberni Clayoquot Continuing Care Society, Director Sika.
Hi, thank you. Yeah, the Alberni Clayoquot Continuing Care Society is experiencing financial difficulties because infrastructure is aging, and so funding for new boiler, updated lifts are putting a strain on the capital budget, and the operating budget is being constrained by slow funding transfers from Island Health for mandated staff wage increases, so that it makes it difficult to have to balance the budget, and this has resulted in decreased staffing. They've had to cut back on staffing and on programming. So just an awareness and a highlight that the transfers from Island Health are impacting our long-term care facilities. Thank you.
Thank you. West Coast Native Healthcare Society, Director Cote. If you could do this report, and then I'm going to ask you to report in the House you attended under Section G, under other reports, if that's okay.
Sure. So West Coast Native Health Care Society, no report. We have a meeting tomorrow. I missed the last one. I think due to UBCM. The Alberni Clayoquot Health Network, we had our meeting today. It was interesting. We're looking for recruitments. So you can think of anybody that would be interested in sitting on the health network. We're looking for people to be nominated. There are also, there's been a request for information for the vital signs for the Alberni Valley. If anybody would like to participate, I think there's a survey for it that you can put your input in. Or if you know anybody who'd be interested in telling their story, that would be great. And I think that's just about it today. Thank you. Maybe Veda has something to add, or Deb.
I have nothing to add. Did you have anything to add, Director Siga?
That covered it. Thanks, Penny.
Thank you. Tofino General Hospital, do you have anything to add, or have we talked enough about it today with our disappointing news?
Well, I do have a small report. I met, we have a new site director out there, Leslie Deshore. Had a good meeting with her yesterday or the day before. We just talked in general about her new role there. She was commuting over into Yuki. She was going to the new health center there, which, I didn't want to bring it up at the time, but it is a thank you to Island Health for the work that they were involved with in the creation. It is an incredibly valuable health facility that we have on the West Coast now, and is not only going to benefit Ucluelet, but certainly the communities, all of the communities in the West Coast region. So that was something positive to have a conversation about. One thing that we did, and is related, of course, to the hospital, as the crumbling infrastructure there. I was just happened to be there for a lab appointment, and there's leaking pipes that are coming into the facility. You have sea cans, literally sea cans in the parking lot. Is where we house our incoming specialists so that they can have their appointments in literally sea cans out there. So that was, once again, just part of the infrastructure conversations that are ongoing at the hospital. And then and some other good news. We did talk about, as we know, up and down many jurisdictions in the province, the closure of emergency rooms. We are at no risk of that here in Tofino in terms of our service delivery in the emergency room. So that was once again positive news. I also I know Penny will be speaking towards, I also attended the Health Forward Summit, the Advancing Healthcare in Central and North Island that was put on by the Nanaimo Regional Hospital District. So I'll wait for Penny to give that report. And I was there with the District of Tofino. So if there's anything to add, maybe I'll have the opportunity to speak towards that as well.
Thank you. Alberni Clayoquot Health Network, he already gave a report. Did you have anything to add, Director Cote? Okay. West Coast General Hospital. So a few directors already mentioned that they're disappointed in the news about the closure of ICU. So both Daniel and I have been in conversation with Island Health yesterday and today. So I'm just going to read you what I know. Island Health has announced that there's going to be a temporary closure of the ICU at West Coast General Hospital starting tomorrow. I want the public to know that if you go to the ER, you will be treated by both ICU physicians and ED physicians. However, if you need prolonged ICU level care, you will be sent to a site that provides ICU services. Most likely this will be the Nanaimo Regional General Hospital, but based on your needs, it could be one of the ICUs in other communities, which is the standard pathway of care. This temporary change in service pathway is not due to the lack of support from Island Health or lack of funding. It is due to the lack of local specialized staffing. Island Health recognized the importance of the ICU to our community and will continue to work hard to attract medical personnel to fill these vacancies. Patient safety and quality of care is of utmost importance to Island Health, and this is the best path forward to ensure that quality of care continues for our residents. So if you do have an emergency, you will continue to go to ER. You will be treated, you will be stabilized. However, if you need prolonged care in the ICU, and that will be about 24 hours, you will be sent to another ICU. So you will be taken care of. So I hope that people will not worry or be be frantic, but it's just due to staffing, and we're lucky it's not a full closure, which many other hospitals are going through right now. It is just a temporary closure due to, not a closure, just a temporary shutdown due to lack of staffing, but you will be treated, you will be taken care of. Do you have any, Daniel and I are meeting with Josie on Friday morning to continue this conversation, but Daniel, do you have anything to add? Okay. If anybody has any questions, I don't know if I can answer them. If not, I will take the question down and I'll ask Josie on Friday. But if you are getting emails and questions from residents of your community, I would suggest you forward them to Island Health or to our MLA, Director Boyko.
Thank you very much. My question is not really about the shutdown, but notification. So if we have a water leak in Banfield or Beaver Creek, we're able to notify the public within an hour. If the staff of the hospital knew about this, and if people at the ACRD, like yourself and Daniel, knew about this yesterday, why was it not released to the public? So the public is hearing about this from Facebook, from the news, from the radio. Why are we hesitant to put that out and allay any fears that are happening right now, as opposed to just releasing the information when we had it yesterday? Thank you.
Well, my response to that is this is not our responsibility. Is there any communications of the responsibility of Island Health? So I'm sure they would be putting out something. Josie is coming out with something later today.
When you have a chance, can you please pass on the lack of messaging and the problems that it's causing? Thank you.
Thank you. Any other questions or comments? Director Roth.
Personally, I'm glad that it was on Facebook. I noticed, I think Dallas Fair put it out there. And actually that's what we need, is people to speak out and make note of these problems. And I really appreciate it. Thanks.
Thank you. Any other questions or comments? Okay, we'll go on to other reports, and the Health Forward Summit attended by Director Cote and Director Steer. Please go ahead, Director Cote.
Thank you. So this is regarding the shared path to wellness, integrating Indigenous healing practices in healthcare systems is one of the sessions that I took. And also AI transformation into Island Health. There was a couple of panels that presented, and I've taken my own notes here, but they're not very good. My scribble, it's actually even hard to read sometimes. So there was a lot of great representation from Island Health. There was representation, the medical director for Island Health. There was actually family physicians, Christine, sorry, can't reach it. There we go. Thank you. There was, there's going to be a report that's coming out from this session that we haven't got yet. There was also a, at the end of the day, we did sort of a questionnaire and something that we could take away. So there was questions. There was what three things did we do right? What were three barriers? With 3 examples of starting recruitment and retention, 3 characteristics of innovative solutions, and 3 recommendations. So we did this at table, so it was quite informative. There was a few good takeaways for me that I keep coming back to, and one of them was the GP for me, have the red carpet roll out to welcome new doctors. Contracts, diversity. So they talked about how doctors are paid these days, an hourly rate versus a patient number of patients, which I think that the doctors are much happier working in that model. They're recognizing what the partners' needs are, things that we've already identified as what would help to bring doctors to our community. So we need to provide housing is number one. We heard at the doctors health summit here a couple weeks ago with the doctors that we had someone that was interested in coming, but they couldn't find any housing, so they had to give up the position, which is really disappointing. So we really need to work on our housing and our offerings to communities as far as opportunities for families of doctors or nurses, or those other opportunities. We need to promote ourselves for what we are, for the authenticity of us, not, we're going to build a pool or we're going to build things. That's not what we're famous for. We have a great history here in mining and forestry and fisheries. We have world-class trails. We have world-class beaches. We have it all here. It's just we need to promote it, in my opinion. And I'd like to see us doing more work in that area. They did say if you would build it, they would come. We want to build a hospital in Tofino. They will come. Those were some of the messages that I heard from the participants in those sessions, and I look forward to getting the final reports, and sharing it with all of you, and hopefully we can discuss it at a meeting like we are having today to see what we can take away and integrate into our plan, our community's plans, our strategic planning, because I think that's where it's going to fit in. And also, I could probably send out, Cindy Solda did video the panel discussions, so I'll see if I can't get it so I can send it out to all of you. Thank you.
Thank you. Director Steer, do you want to add anything?
Yes, thank you, through the chair. Just quickly, I just wanted to just what the focus is in the Health Forward Summit. What it did was it brought together leaders from First Nations, the government of British Columbia, local governments, health authorities, community health organizations, and other partners to discuss the future of healthcare in the Central and North Vancouver Island region. So that was the focus. And as Director Cody pointed out, there are a number of breakout sessions, everything from smart health, exploring how AI is transforming healthcare, strong foundations, preventative healthcare, which was a big focus and one that I attended. There were a number of others, and how investments in healthcare infrastructure and systems energizes regional economic growth, and which is really interesting to tie into the conversation we just had around the build of a hospital. So there was a lot of really interesting information about investment in healthcare infrastructure and how that promotes regional economic growth. It was a fascinating session. And then there were shared pathways to wellness, as Director Cody pointed out. And then we did have that facilitated problem-solving session, which was to try to reimagine strategies for physician and specialist recruitment and retention. That was the whole afternoon. Took the whole afternoon to have that discussion, and a number of breakout groups. There's about at least close to a dozen tables there that did have those discussions. And as Director Cody pointed out, there will be a forthcoming summary of the summit. And some of there were a number of solutions that were coming out. It was not just a gathering to provide information, but I think there will be some key takeaways, as Director Cody pointed out, a number of those. That will be forthcoming. There was no time frame associated with that, but I suspect it will be coming just into the new year. So it was very well attended and very valuable.
Thank you, Director Cote and Director Steer. I'm very disappointed I wasn't able to attend. And when you get those summaries, would you be able to pass them on to me? If you wouldn't mind, that would be awesome. Thank you. Any other reports? Could I have a motion that the Regional Hospital Board of Directors receive reports A through G? Moved by Director Roth, second by Director Steer. All in favor? Any opposed? Motion is carried. No unfinished business, no late business. Question period. Is there any questions online, Cynthia? Oh, Director Roth, please go ahead.
I just didn't know where to ask this one. I'm just curious, will the ministry or the new Ministry of Infrastructure affect local government at all as far as their infrastructure projects go? I'm just curious.
Yeah, through the chair, I don't think it would. I think we would have received, I hope we would have received a briefing if it did. I mean, some of the projects that they're identifying in terms of the ministerial overview is working with the Ministry of Education on plans to build schools and new childcare spaces, working with the Ministry of Health, as we know, with hospitals and medical facilities, post-secondary, it's infrastructure again, citizen services, it's government lands prior to disposition, and Ministry of Transportation. So it doesn't say anything about our ministry, so for local government, and so it's a good question. It would be a good question as to whether or not after a grant, so let's say if we did apply and get a grant for a pool or anything along those lines that we were planning on doing, whether or not they would weigh into the issuance of a grant. Yeah, but it doesn't appear to be the case. But I will be informed, hopefully next time I take a kick at this can.
Director Steer. You're muted, Director Steer.
It says I'm unmuted. Anyways, okay. Am I good to go? Great, thank you, and I appreciate Director Roth's question because it ties in. One of the interesting things that I was, and I'm going to wait for the Ministry of Infrastructure to come there, because one of the conversations that we've had at this board table is around dedicated medical facilities, and I think directly of the Sobering and Assessment Center in Tofino as an example, and down the road in Ucluelet with the medical center there. And so these are questions that I'm going to have for the Ministry of Infrastructure when they come in as they relate to medical facilities or health facilities within our region. And then it also ties into those capital contributions that this regional hospital board will be making to those capital infrastructures, in which, well, I'm sure when Terry presents to us, will inform a lot of the conversations we'll have around our budget and around those pieces of capital infrastructure that will be going hopefully forward in our region in the near future. So those are some of the questions I think I'm going to be very much interested in having with the Ministry of Infrastructure when it comes to healthcare facilities within our region.
Thank you. Any other questions from directors? Any questions online?
No questions received through email and none through Zoom.
Thank you. Before I call for adjournment, I just want to say I think this was a great meeting. It was much more effective than just 5 minutes trying to rush through at the end of the day, and I really appreciate everybody's participation and attendance today. Could I get a motion to adjourn? Moved by Director Sparrow, second by Director Roth. All in favor? Any opposed? Motion is carried. Thank you so much, everyone.
Figured I'd just wait over your Your mic's still on.